Place the patient in a true lateral position, either seated or standing, before a vertical grid device. Have the patient sit or stand straight and adjust the height of the IR so that it is centered at the level of C4. The top of the IR is about 2 inches or 5 centimeters above the EAM. Move the patient close enough to the vertical grid device to permit the adjacent shoulder to rest against the grid for support. Keep the mid-sagittal plane of the patient's head and neck parallel with the plane of the IR. Ask the patient to drop the head forward and then draw the chin as close as possible to the chest so that the cervical vertebrae are placed in a position of hyperflexion. Ask the patient to elevate the chin as much as possible so that the cervical vertebrae are placed in a position of hyperextension for the second exposure. Respiration is suspended. Place the patient in a supine or upright position facing the X-ray tube. The upright position, either standing or seated, is preferable for the patient's comfort and makes it easier to position the patient. Adjust the body, including the head, at a 45-degree angle, and center the cervical spine to the midline of the IR. Center the IR to the third cervical body, 1 inch superior to the most prominent point of the thyroid cartilage, to compensate for the cephalic angulation of the central ray. The central ray is directed to the C4 at a cephalad angle of 15 to 20 degrees so that the central ray coincides with the orientation of the foramina.